The OBR segment. OBR is the order detail segment. It contains domain-specific information about an order. What does domain-specific mean? Domain-specific means it is specific to radiology domain, or it's specific to cardiology domain, or it's specific to lab domain. Domain basically just means a different department in the hospital. Whereas the ORC segment contains general order information, it is the OBR segment that contains specific information intended for the receiving system. The OBR segment will tell you exactly what is being ordered, whether it's an x-ray or a lab test or a medication order, and consequently the OBR segment will look different in a radiology order versus a lab order versus a medication order. The OBR segment has lots of fields, and many repeat the information contained in the ORC segment. There are lots of fields that are specific to non-radiology systems. For our purpose, we'll focus on the fields in the OBR segment that are radiology specific. That's OBR 4, the Universal Service ID, OBR 13, Relevant Clinical Information, OBR 16, Ordering Provider, OBR 30, Transportation Mode, and OBR 31, Reason for Study. OBR 4 is a required field. OBR 4 is called the Universal Service ID. In layman's terms, it contains the procedure code and the procedure name. So I'm not quite sure who came up with the idea of calling this the Universal Service ID. It sounds a lot more complicated than it is. For example, it might look like this: 9300 electrocardiogram. In this example, the procedure code is 9300, and the exam to be done is an ECG. Incidentally, 9300 happens to be the CPT code for ECG. Most places have their own internal codes for exams and do not use the CPT code in OBR 4, and we'll get into coding next year. We won't even touch on coding this year, so just a little extra for you there. CPT codes. You can look it up if you're bored on a Sunday. OBR 13 is an optional field in HL7. It's required in IHE. OBR 13 is called Relevant Clinical Information. It contains the relevant clinical information. Relevant clinical information, however, is not the reason for the exam. Rather, it's other information about the patient that is relevant to the requested study. So here is an example. The exam ordered is chest x-ray. The reason for the exam is productive cough times 1 week. The relevant clinical information is patient was treated for tuberculosis 3 months ago. Right? So that's relevant clinical information to their productive cough. Is this a relapse of their tuberculosis, or do they have a pneumonia? So this lets the technologist and radiologist know the patient has a cough and it might be related to TB, and that's the purpose of relevant clinical information. OBR 16. OBR 16 is an optional field in HL7. It's required in IHE. I wonder how many times in these slides I say that. Optional in HL7, required in IHE. OBR 16 is the ordering provider. It contains the ordering doctor information. What makes it an optional field is that the ordering doctor could be in ORC 12. If ORC 12 does not contain the ordering provider, it must be in OBR 16. And many places populate both fields, and they should always have the same ordering doctor information. If somehow the ordering doctor in ORC 12 is different than the ordering doctor in OBR 16, there's a good chance that the message will fail. There should only be one ordering doctor for an exam. So think about this for a minute. You go see your doctor for foot pain, and he sends you to get a foot x-ray. Your doctor that sent you for the foot x-ray should have his name in ORC 12 and OBR 16. You don't go see a doctor, have him write an order for a foot x-ray, and before you go get the foot x-ray, go see another doctor and have him just tack on to that. I mean, that workflow doesn't exist. That's some crazy crap I just made up. So ORC 12 and OBR 16 should have one doctor, and it should be the same doctor. OBR 30 is an optional field in HL7. It's required in IHE. OBR 30 is transportation mode. It contains information about how the patient will be traveling to the radiology department, and this is almost exclusive to inpatients. The 4 possible values are cart, patient will be coming on a stretcher; port, this exam needs to be done portably at the patient's bedside; walk, the patient is ambulatory; and WHLC, the patient is coming by a wheelchair. And we used the abbreviations from Epic. if you work at a hospital or shout at a hospital that uses Cerner or RadNet, they may use different abbreviations here. They might put wheel instead of wheelchair. They might put stretch instead of cart. So, but you get the idea. There's basically 4 ways patients get transported around. They're either portable, on a stretcher, they're walking, or they're in a wheelchair. OBR 31. OBR 31 is an optional field in HL7. It is required in IHE. It is the reason for the study. This is the reason the doctor ordered the exam. To be considered a valid order, there must be a reason for the exam. If OBR 31 is blank, the exam should not be performed and cannot be billed for if it is done. Also, the radiologist will not read the exam without a reason for the study. So, reason for study is very important for medical reasons, legal reasons, and billing reasons. If there's no value in OBR 31, they don't give a reason why you're going to use radiation to examine this patient. The tech shouldn't do it. The radiologist won't read it. You can't bill for it. It just shouldn't happen. So OBR 31, even though it is optional in HL7, should never be blank because the exam won't get done. So that's all about the OBR segment.